Is diabetic kidney disease reversible? Hi, I am Dr. Dinesh, consultant nephrologist, Sparsh Hospital, Infantry Road. So this is a common question most of the patients who come to me ask: Is diabetic kidney disease reversible? The diabetic kidney disease is a complications of long-standing and uncontrolled diabetes, which happens in both type 1 and type 2 diabetes, where there is a damage to microvasculature of the kidneys, leading to loss of kidney function over a period of time in some of the patients. Definitely, diabetic kidney disease is reversible if we act at the right time and in an appropriate way. See, as previously we have discussed, they are in the early stage of diabetic nephropathy. There is a hyperfiltration stage which happens in 5 to 8 years of diabetes, and microalbuminuria stage when there is small amount of loss of proteins in the urine. These are the two stages we have to pick up early. It's very crucial to pick up early because this is the place where at least try to halt or prevent the progression of diabetic nephropathy. Several studies which has been done and is been published in a new journal of England of 40% chances of reversing or preventing the progression of diabetic nephropathy when there is a tight control of blood sugars and when we bring down the HbA1c target of 7. And in the type 2 diabetes methods, in type 2 diabetes methods, like studies such as UKPDS, advanced studies have also shown that tight control of diabetes definitely reverses or progresses or prevents the progression of diabetic sugars has to be optimized. The drugs which have recently come, such as SGLT2 inhibitors, such as dapagliflozin, which along with the controlling of blood sugars, also act as renal protective medications by causing vasodilatation of the blood vessels. That is decreasing interglommerular pressure. So the most important thing is controlling the diabetes itself, which is the culprit for progression of diabetic nephropathy. Second is the blood pressure. So the blood pressure can be primarily because of diabetes itself, or it can be associated with diabetic nephropathy, or it can be a part of diabetic nephropathy. So we have to target the blood pressure less than 130/80. As low as possible is it's better for the patients. So drugs such as AC inhibitors and ARBs, along with the controlling the blood pressure, they act as renal protective medications. So we have to advise the patient on the patient has to put on the low salt diet. Patient has to strive for healthy weight. So moderate exercise. Quitting the smoking. If patient is smoking, the smoking is the worst thing for the renal disease. So you have to quit the smoking. Fourth is you should not take unnecessary painkillers, especially NSAIDs, which further damages the kidneys. Like patient has to get basic tests like HbA1c. Patient has to undergo urine tests to pick up any loss of proteins early and intervene as early as possible. Because there's a silver lining. Okay? This is a lining. There's a small lining between advanced diabetic nephropathy and early diabetic nephropathy. So an urine test, check your estimate your EGFR. Will give us an estimate of how much kidney function is available and acting at the right time. And last but not least, educating the patient is very important. We say knowledge is power, and especially we have to at this time, as India is known as diabetic capital city of world, it's very important that we have to educate the patients so that we can live a healthy life. We can and prevent all the complications of long-standing diabetes. Thank you.